Hi everyone, my name's James Westgate, I'm the editor of Vet Times and welcome to the London Vet Show. Today I'm delighted to have been invited to the Zoetis stand where I'm joined by Sophie Duguid, the Diagnostics National Veterinary Manager for Zoetis. Hi.
Hi there.
And we're here to talk about the Vetscan Imagyst, the AI masses launch. So I know the system has already got 6 different tests, I believe, already. So just run us through those and then we can talk about AI masses.
Yeah, for sure. So we launched Vetscan Imagyst back in 2020, and we initially launched with artificial intelligence that was capable of looking at fecal samples in dogs and cats. And then every year since then, we've launched new capabilities. So 2021 was digital cytology, 2022 was blood smear with AI, and then we moved into dermatology, urine sediment, equine fecal, and now we've brought out AI masses on the Vet Show.
So that can help identify potentially neoplastic cells. Just to explain a little bit how that works for us.
Sure. So essentially in practice, we may see patients come in, dogs, cats, present with a lump. And we need to perform a fine needle aspirate. So essentially we need to take a sample of that lump and then understand what it's comprised of. And so we actually worked on AI technology to read that sample and give the vet a first pass on what cells are in there. Are they neoplastic or is this a benign lump? So we've done that for masses, so skin and subcutaneous lumps. We've also done that for lymph nodes as well. So actually, can we take an aspirate of a lymph node and establish, is it enlarged because of inflammation, or is it because there's cancerous cells? Mm-hmm. So it's a really neat little triage tool, first pass tool to tell you, is it cancerous, is it not, or do you need the expertise of a human to look at that sample for you?
Why AI masses now? Why wasn't that at launch? Is this tech that takes a long while to develop, isn't it, to get it right? We were talking off air, if you like, about there's a certain amount of skepticism around certain uses of AI in the sector, and it's really important that companies with the size, the scale, the R&D budgets of Zoetis do this properly. I think we spoke to Richard Goldstein at the Berlin launch of the AI masses, and I think his takeaway quote was, "This isn't chat GPT," which is a really important message to get home, I think.
For sure, yeah. I think, so AI is such a rapidly evolving field. We're seeing it impacting in lots of different areas of the veterinary practice as a business, but also in terms of clinically as well. And I think it's really important that when you're training AI that you have robust data to do so. And it's really important for us as veterinary professionals to actually scrutinise the data as well. Have a look at actually what's gone into training it and validating it also.
So vets at every stage of the process here. You've not just had a bunch of AI tech boffins away in an ivory tower doing this. They've been proper vets on the ground, making sure this stuff's absolutely correct.
Yeah, so for artificial intelligence and diagnostics, we actually work with a clinical pathology team. And in essence, when we bring out AI applications on the Imagyst platform, we want it to be as good as a clinical pathologist looking at that sample. And so that we therefore compare its performance against that of clinical pathologists. Mm-hmm. So we want it to actually have the level of accuracy of a human expert. But I think what you said there was 100% accurate. We're in the field of cancer detection. And so with that, there's a little bit more involved with that. Sometimes it's difficult to call. Sometimes a mass might, look suspicious, but we can't quite call it. So that's why it's important to bring in the human expertise as well with that.
And that's a 24-hour global system of experts that will back up this. If you have any doubt, then or the next stage, you can elevate that straight away to a team.
Absolutely. So, we have our team of clinical pathologists. They're a global team, and they're available 24/7, 365. So at any time point where you want that human pass on the sample, you can avail of that support, and you can get results back within 2 hours essentially, so that you can kind of make a plan.
I think most humans would like to have those sort of results back in 2 hours, wouldn't they?
Absolutely, yeah.
But so what are some of the benefits of employing this sort of technology? It's accurate, it's fast. What are the benefits to practices? What are the benefits to the vets and the vet techs in practice using this? I'm imagining there's a big time saving. They can perhaps spend more time doing the things they want to be doing.
For sure. So I think the first thing is that we're not asking vets, when it comes to taking the samples, we're not asking vets to do anything differently than they're already accustomed to and familiar with. So the sample preparation is similar to what they're used to. And then the analysis part is taken over by either AI or by sending it to a human expert. So there's no demand on your time, which is already in limited or short supply. So it kind of eases that pressure from the laboratory side somewhat. I think you said yourself, that speed is also important, particularly when we get into the realms of cancer detection. If you and I are waiting a diagnosis, we want it sooner rather than later, so we can then come up with a plan on how to deal with it and address it quickly. And that hopefully will lead to better outcomes for the patient. Actually clinically, does that improve quality of life? Does that lead to better longevity? Because we've removed it sooner and started a treatment quicker. And also it's about the accuracy. So it's all well and good having speed, but not at the expense of having an accurate read on the sample. Again, if you're making a critical judgment on a sample, we need to have accuracy to make sure we're making the right call on that diagnosis.
I can see the benefits there for the clinician. For the practice at large, sort of from a profit point of view, from that side of thing, is this an expensive technology to employ, to charge as well?
Yeah, so I think from an AI Imagyst perspective, what we've done is looked at using AI technology, at a more cost-effective price point as well, but still also have that accuracy and that speed and turnaround time. So I think for me, what we're looking to do is actually looking at, can we be looking at lumps that perhaps we don't aspirate? Sometimes in practice, we see a patient come in with a lump and we do a physical exam and we kind of guess, it feels like a fatty lump, it's probably a lipoma, it's probably going to do nothing, and we assume. But actually, we should really be maybe thinking of aspirating that and be sure that it is indeed a fatty lump, and we can leave it and monitor it.
To get definitive answers for the clinician and perhaps far more importantly, the owner, because as you just alluded to, when you think your pet has a problem, you're going to do nothing but worry about it, aren't you?
Yeah, absolutely. So I think for me, it's about actually, from a vet's perspective, providing that insight and actually making decisions with that pet owner for the best interests of their pet, and actually including the pet owner in that decision-making process.
Simple question, maybe simple answer, but is this stuff easy to use?
Yeah. So for me, what's really important is that we actually help support vets, either preserve clinical skills, enhance clinical skills. So again, we're using sample preparation methodology that vets are very familiar and accustomed to. We can support around that if they need it. But also the sample itself, the technology we're using, essentially it looks the same as if you were going to use a practice microscope. So the images that the platform, the Vetscan Imagyst, shares with you is recognizable. So you yourself can have a look at that sample and actually have a check in yourself to make sure you're happy with what the AI is telling you. And again, aside from that, you've got the backup support of the ClinPass.
That can't be overstressed enough, can it? Human in the loop all the way in this process.
It's critically important. You mentioned Richard, and he said, this is not ChatGPT. Even if you use, generative AI, you still have to check it. You still have to read it.
We have to do the same in the media, yeah.
Yeah, so you still need that human involvement, because sometimes it doesn't quite get the word right, or it's, you need a bit of a correction there. And it's really important that we actually know how we use AI, where it's best used, and actually when we need to actually add in that expert to take a look at that for us.
So it improves efficiency, but it also improves clinical outcomes. It's also important to say Zoetis aren't turning their back on traditional sort of reference labs. I think they just bought the veterinary pathology group, so that's a big imprint for them in the UK and in Europe. But this is clearly a big focus for the company. Big focus, I'd say, for the profession at large as well around AI. So can you tell me anything, just to wrap up, what some future developments for this platform are? Is there anything else coming down, or is it just going to be a sustained commitment to this AI from Zoetis?
Yeah, I think for me, when it comes to AI, there's like a couple of things on the platform itself. So, whenever you look at the different sample types that we can run through currently in the Imagyst, essentially anything we can put on a glass microscope slide, the potential is that you can train AI to look at it. So there's a whole myriad of samples that potentially we can train AI to read. But it's not just looking at adding more capabilities, it's actually looking at, is there anything we can do on existing AI capabilities? Like, can we add in other cell types that it can recognize? So AI masses we've launched this year, 2025. Can we look at other tumour types that we can add to the platform just to expand that clinical value? So again, it's looking at adding more clinical value, but also looking at, can we actually look at the performance as well? Can we actually, look at the performance, increase the sense and spec on certain areas? So again, we're constantly looking at how do we improve this platform for the betterment of our patients and our veterinary surgeons who are using it.
Fantastic. Well, exciting times ahead. I think that's a great place to leave it. So thank you for your time, Sophie.
Thank you, James.